Hello and welcome to True Pathfinder, your portal to health and truth. And in this video we are going to look at the psychosomatic causes of chronic conditions such as rheumatism, rheumatoid arthritis and osteoporosis. So, without further ado, let's dive right into it. And we're beginning by looking at the periosteum, and you're gonna see why in a little while in the course of this presentation. So what is the periosteum? It is the medical definition for the membrane of blood vessels and nerves that wraps around most of your bones. It's what delivers bones their blood supply and gives them also their sense of feeling. Special cells in the periosteum help your bones grow, develop and repair them after bone fracture. And the periosteum has three functions. First, supplying blood to your bones. Secondly, giving them their sense of feeling and also growing and repairing your bones. The blood vessels in the periosteum connect back to your circulatory system to supply fresh, oxygen-rich blood to your bones, and the nerves in the periosteum give your bones and the area around them a feel. Your periosteum helps your bones grow and develop, and special cells called osteoprogenitors create so-called osteoblasts, which are the cells that produce your bones. Babies and children whose bones are still growing and developing have many active osteoblasts in their periosteum. But as you age and your bones stop growing, you start having fewer and fewer of these osteoblasts. However, when something damages your bone, like a fracture for example, your osteoprogenitor cells wake up and start creating new osteoblasts to heal your bone. The most common issues that affect the periosteum are periosteitis and bone fractures. Almost all of your bones are covered in this periosteum. It covers every part of your bones except the places kept in cartilage and the spots where the ligaments and your tendons attach. The only bones not covered by the periosteum are the sesamoid bones that are embedded in your tendons or muscles, and your sesamoid bones are in joints throughout your body, including your patella, so your kneecap, your hands and wrists, and your feet. And because they don't get a direct blood supply from the periosteum, these sesamoid bones usually take longer to heal than other bones. The periosteum has two layers. The outer layer protects the inner layer and the bone beneath it, and it's made of thick collagen fibers. Most of the periosteum's blood vessels and nerves are in the outer layer. The inner layer, that is also sometimes called a cambium layer, contains the osteoprogenitor cells and the osteoblast they create when your bone grows or needs to heal, as we've discussed. And the periosteum in general is thicker in kids and younger people and thins as you age. At first, the periosteum was lined with squamous epithelium, and after the muscles, the ligaments, the tendons, and the two skin layers, the corium skin and the epidermis, had given new support to the bones, the epithelial layer degenerated. In fetal development, this process occurs during the first 2 weeks of gestation. And what remains is a sensitive network of nerves. The neural network of the periosteum also has two layers. A lower layer, which registers the pain caused by the swelling of a healing bone, and an upper layer, which generates the rheumatic pain. The periosteal nerves originate from the ectoderm and are therefore controlled by the cerebral cortex. The innervation of the entire periosteum originates in the spinal marrow of the cervical spine. The postsensory cortex, which is part of the cerebral cortex, controls the periosteal nerves, and the periosteal nerves of the right side of the body are controlled from the left side of the cortex, and the ones on the left side of the body are controlled from the right cortical hemisphere. And hence, we have a crossover correlation from the brain to the organ. The premotor sensory cortex controls the periosteal nerves of the dura mater, and in line with evolutionary reasoning, territorial conflicts, sexual conflicts, and separation conflicts are the primary conflict themes associated with organs of ectodermal origin controlled by the sensory premotor sensory and postsensory cortex. The biological conflict linked to the periosteum is a severe separation conflict. Compared to the separation conflict related to the skin, the competition linked to the periosteal nerves is experienced as more dramatic, even brutal or cruel. And depending on the exact conflict situation, the separation might be associated with the arms, so not being able to hold a beloved person or a pet, the hands, so when you have the feeling that a loved one is slipping away, the legs and ankles, when you want to push someone away, or the feet and toes, when you have an unwanted move. The periosteal nerves lining, the eye socket, correlate to a visual separation conflict, so having lost sight of someone. And just like the epidermis, competition also corresponds to wanting to separate from a person or a place. The separation conflict related to the periosteal nerves only refers to a separation from a person or an animal, such as a pet, but not to objects such as jewelry, your car or a house, or a break, let's say, from your home. Each psychosomatic or biological conflict has two phases, a so-called active phase and a healing phase. So let's look at what happens in each one of these distinct phases. But before we do that, a short reminder, if you enjoy our content, please support us directly by becoming a patron from as little as $5 per month. Link is in the description box below. Also, do not forget to like, share, subscribe if you're not already, and comment to help the channel grow and spread the truth. For the holistic care you need and deserve, please contact us at christine.doctor. We will assess you remotely and develop a customized, holistic, natural healing plan just for you. And we always take, of course, into consideration this psychosomatic part of your condition as well. And please check out some of the most powerful holistic health tools available on the market today at vibrantbody.net. Links, as always, also in the description box below for you. Alright then, what about the first phase of the conflict, the so-called active phase? The biological special program of the periosteum follows the gullet mucosa sensitivity pattern with hypersensitivity during the conflict active phase and hyposensitivity in the healing phase. During the conflict active phase, there is a hypersensitivity of the affected part of the body, and conflict activity with a separation conflict is always accompanied by short-term memory loss, which serves the purpose to forget temporarily the one who has left by blocking out the memory. The periosteum belongs to the group of organs that respond to the related conflict with hyperfunction or functional loss, like the inner ear in the cochlea and the vestibular organ, or the olfactory nerves, the retina, and the vitreous body of the eyes, as well as the islet cells of the pancreas and the skeletal muscles. And the symptoms include tingling and a sharp stinging pain, and this neuralgic pain is commonly referred to as rheumatism. There might also be a soreness to touch. Severe or long-lasting pain can trigger also a self-devaluation conflict involving the underlying bone, causing rheumatic pain in the healing phase. And we call the combination of the two biological programs bone syndrome. The pain that reaches the muscle tissue generates soft tissue rheumatism compared to fibromyalgia, and also the affected part of the body feels cold. So cold muscle pain points to conflict activity related to the periosteum, whereas so-called hot muscle pain is a sign that the muscle is healing. And this is why warming the area is soothing and alleviates the pain. Whether the right or the left side of the body is affected, or both, is determined by person-centeredness and whether the conflict is mother-child or partner-related. A localized conflict involves the part that is associated with the separation conflict. If we look at the CT scan here on the right side, it shows the impact of a severe separation conflict in the postsensory cortex, more precisely in the area that controls the right and left hand as well as the fingers. The focus on the right side is noticeably more significant than the one on the left, and the sharp borders reveal conflict activity, hence the stinging rheumatic pain in both hands. In this case, more in the left hand than in the right one. The periosteum and the arteries are both innervated from the sympathetic trunks, and hence, during conflict activity, so during sympathicothonia of a separation conflict involving the periosteum, the capillaries narrow, causing restricted blood circulation. During conflict activity, the affected area also shows reddish-purple bumps, like frostbites, that occur as a reaction to the exposure to frigid temperatures. The medical term for this condition is keelblinds or pernio, which is the Latin word for frostbites. Keelblinds on the toes could be caused by the distress of having to separate or wanting to separate from a certain place. And the condition can involve the top and or bottom of the toes. With an intense conflict, the affected areas turn white due to the reduced blood flow. And this condition is termed Raynaud's disease. If the conflict persists over a long period of time, the tissue eventually dies, resulting in gangrene. And the amputation of the affected limb does not necessarily remove the pain. A rheumatic phantom pain will occur if the person is still in the conflict active phase. Foot and leg ulcers develop when the biological conflict of the periosteum and of the epidermis run concurrently, and both are linked to a separation conflict. During the conflict active phase, the ulcerated area of the skin opens, creating a hole, and often this occurs in the area of the lower leg or ankle, wanting to push someone away in defense. A person-centeredness determines whether the conflict is mother-child or partner-related. The periosteal nerves are part of the peripheral nervous system. In conventional medicine, the nerve pain as well as the numbness are referred to as peripheral neuropathy. It is a widespread belief that high blood sugar causes damage to the arteries and indirectly to the nerves, resulting in pain or loss of sensation, especially in the extremities. Yet, interestingly enough, not every diabetic develops the condition. Neither can this assertion explain why an elevated glucose level would, for example, affect the feet, or just one foot, or just one toe in one person, and the arms in another. What is called diabetic peripheral neuropathy is a combination of two biological conflicts running simultaneously. One involves the beta islet cells of the pancreas linked to a resistance conflict causing diabetes, and the other involves the periosteum in case of the legs to wanting to kick somebody away, usually a person who resists, of course, with the development of leg ulcers or gangrene, depending on the intensity and duration of the conflict. And when you resolve such a biological conflict, you move into the healing phase. The CT scan here on the right presents a focus in the area of the brain that controls the periosteal nerves of the right leg. The sharp border of the ring structure indicates that the separation conflict is still active, presenting itself as neuralgic pain in the right leg. Trigeminal neuralgia occurs when the separation conflict was associated with the face, either literally, so a loss of cheek, or figuratively, so a slap in the face. The sharp, electric-like pain along the trigeminal nerve, which is the fifth cranial nerve innervating the face, is brief but strong and might reoccur many times over the course of the day. The condition is usually confined to one side. The trigeminus nerve has sensory and motor branches, and the motor branch of the nerve is affected by facial paralysis. In the healing phase, we see hypersensitivity. Because of the loss of sensitivity, the affected part of the body, so the hands, the arms, the legs, or the feet, feels numb. And the short-term memory loss reaches into the healing phase as well. The rheumatic pain may return, typically during the night hours, and during the final phase of the healing process, the sensitivity slowly normalizes, provided again there are no conflict relapses causing pain flare-ups. Healing phase, controlled from the sensory, post-sensory or pre-motor sensory cortex, are always accompanied by troubled circulation, dizzy spells, short disturbances of consciousness or complete loss of consciousness, such as fainting or being absent, depending again on the intensity of the conflict. And another distinctive symptom is a drop in blood sugar caused by the excessive use of glucose by the brain cells. So the biological conflict linked to the bones and joints is a severe self-evaluation conflict or a loss of self-worth conflict. The cartilages, tendons, ligaments, lymphatic system, and the blood vessels correlate to a light self-evaluation conflict. When a long bone, such as the bones in the arms or the legs, recalcify, a hole is left in a particular area to allow the edematous fluid to drain. And in this part, the liquid creates a temporary peripheral edema. Arthritis is the healing of a joint accompanied by inflammation. What is wrongly termed acute joint rheumatism is when the fluid in the edema, usually in big joints such as the knee or shoulder, pushes through the cartilage into the joint, causing a transudative effusion. And this is typically the case with a concomitant water retention due to a kidney syndrome. Conflict relapses also increase the swelling, and as a result, the joint becomes red, hot, and swollen. If such a swollen joint is punctured for experimental purposes, for example, it can create extensive osteosarcomas. The swelling outside of the periosteum also occurs when the fluid of the bone edema leaks through the membrane of the periosteum. If this happens in the groin or the area of the top of the femur, the swelling is often misdiagnosed as a thrombosis. Chronic arthritis is a sign that the healing process cannot be completed because of constant conflict relapses. With arthritis, a person is quickly in a vicious cycle since the arthritic pain and the restriction of movements often causes another self-evaluation conflict at the exact location. Sooner or later, this will freeze a joint, for example, your shoulder, as you can see in an image here on the right. Polyarthritis, affecting many joints, reveals that a person had suffered the self-evaluation conflict in a generalized self-evaluation way. Still's disease combines joint pain with skin rash, and this translates into concurring healing phases of a self-evaluation conflict and a separation conflict, most likely linked to the same conflict situation. With water retention, due to the kidney syndrome that is caused by an abandonment conflict involving the kidney collecting tubules, arthritis then becomes gout. The elevated uric acid levels lead to the belief that a vegetarian or low purine diet would alleviate the pain. However, the real cause here and the problem that needs to be addressed is often the underlying abandonment and existence conflict. Gout in the joint, the base of the big toe, is commonly associated with excess alcohol consumption, although not every heavy drinker has gout. If, however, the intoxicated condition triggers a conflict of not being able to walk or not being able to balance, the development of gout is pre-programmed. Whether it affects the right or left toe is again determined by a person's centeredness and to whom the self-evaluation conflict relates. Is it to the mother or is it related to the partner or the children? The biological conflict linked to the bones and joints is a severe self-evaluation or loss of self-worth conflict. The cartilage, tendons, ligaments, lymphatic system and blood vessels correlate to a light self-evaluation conflict. And in line with evolutionary reasoning, self-evaluation conflicts are the primary conflict theme associated with cerebral medulla controlled organs that derive from the new mesoderm. A generalized self-evaluation conflict concerns the whole person. The competition is experienced, for example, through humiliation, for example, caused by accusations, scolding, and derogatory remarks, or abuse, whether it is physical, sexual, or verbal, failure, whether it is at work, at school, in sports, or in a relationship, poor performance, whether intellectual, artistic, or athletic, or feelings of shame and guilt. The loss of status, the loss of a workplace, retirement, illness, or injuries, where you feel that you're out of commission, aging, where you feel not as good as you used to be, or where you feel that you're getting useless, or the loss of a person who made one feel appreciated and needed are other conflict scenarios. And the way we perceive ourselves or speak to ourselves, whether you tell yourself I'm a failure or I will never succeed, also creates mental predispositions for generalized self-evaluation conflicts. Children and older people are more vulnerable to suffering such a conflict. A localized self-evaluation conflict relates to a specific part of the body. For example, a poor artistic or athletic performance corresponds to the hands or the legs. Self-evaluation strife brought on by a cancer diagnosis, an unfavorable prognosis, where, for example, your doctor tells you will not be able to walk again, or the removal of an organ, for example through a mastectomy, or continuous localized pain correlates to the nearest bone or joint. A moderate self-devaluation conflict would involve the closest lymph node or muscle, and each part of the skeletal system has its specific conflict content. During the conflict active phase, the affected bone decalcifies, creating gaps and little holes in the bone, and the exact type of self-devaluation conflict determines the location of the osteolysis, so the bone breakdown. The decalcification of the bone increases the serum calcium levels and leads also to the loss of bone marrow that occurs together with the bone osteolysis, and this alters the blood parameters. A decrease in bone mass is commonly called osteoporosis or brittle bone, and conventional medicine says that osteoporosis is linked to a decline in estrogen production in women after menopause. However, the theory of a correlation between bone loss and estrogen deficiency is purely hypothetical because there are postmenopausal women who don't suffer from osteoporosis, and there are women who do suffer from osteoporosis way before the menopause. And men get osteoporosis as well, and so do children. But men and children are not under pressure to undergo regular bone density tests. And this is because they are not yet considered to fall into the risk group. Osteoporosis in men is also played down as it doesn't fit the definition of a woman's disease caused by a lack of estrogen. Osteoporosis, from a psychosomatic point of view, is caused by a generalized self-devaluation conflict that is ongoing and that affects most of the skeletal system. The steady bone decalcification caused by discontinuous, often subtle, self-devaluations could be compared with dripping water, in line with the saying, constant dripping wears the stone. Based on the psyche-brain organ relation, osteoporosis in postmenopausal women has nothing to do with a reduced estrogen production or calcium deficient diet, but instead with a woman's attitude towards aging and the changes that come with menopause. In societies where women age naturally and without a Western anti-aging hype, older women don't usually get osteoporosis. The osteoporosis diagnosis and the fear of crippling disease also themselves contribute to other self-devaluation conflicts that lead to a chronic condition. If someone already has cancer, the loss of bone tissue is usually diagnosed as osteolytic bone cancer or bone metastasis, even though there is no tumor growth. In most cases, the self-devaluation conflict is triggered by the diagnosis of the first cancer and the unfavorable prognosis, or the debilitating side effects of the cancer treatments. And this is why bone cancer is the most frequent secondary cancer next to lung cancer. Typically, the bone cancer develops close to the site of the primary cancer, thus in the sternum and ribs with breast cancer or the lower back with prostate cancer. Suppose the tendons or ligaments are affected by a self-devaluation conflict. Well, in that case, the cell loss presents itself as soft tissue necrosis with an increased risk of injury since the weak tissue ruptures easily. For example, this can happen with an Achilles tendon tear originating in a heel-related self-devaluation conflict. Prolonged loss of cartilage, for instance, in the knee or the hip, is called arthrosis, also known as osteoarthritis, not to be confused better with arthritis, which occurs, as we've discussed, when a joint is healing. So there you have it. It's always important as with these rheumatic conditions, arthritis, arthrosis, osteoporosis, to look not only at the physical causes, but also at the psychosomatic side of the condition. And this is exactly what we do when we take care of you here at Christine.Doctor. We look at everything holistically. So please do not hesitate, contact us. Link is in the description box below. And wherever you are in the world, we will assess you correctly, find out the real causes, and develop a natural holistic healing plan that works. Also, check out some of the most powerful holistic health tools available on the market today at vibrantbody.net. Some of them are really good for those conditions, to take care of them. And if you've enjoyed this presentation, as always, please be so kind and support us directly by becoming a patron from as little as $5 per month. Link also in the description. And do not forget to like, share, subscribe if you're not already, and comment to help this channel grow and spread the truth. With all that being said, thank you very much for your attention, and until next time, stay healthy.